Welcome, it's Dr. Durst. Snoring versus sleep apnea. What's the difference and which one do you have? Well, snoring is that sound that's made when you're breathing through your nose or your mouth, keeps the other person up, the partner. So I think men would say women snore a lot, and women would say men snore a lot. And the facts are it's common in both. So it can happen with lots of alcohol intake, sleeping on the beach after alcohol intake. It can also happen with sedatives, but it can happen if you're overweight or need to lose some weight. So, but it could be a sign of something more serious, such as sleep apnea. So basically, snoring is present in sleep apnea, but you're not actually stopping your breathing. With sleep apnea, you're actually starting and stopping breathing while you're snoring. And that can lead to significant problems such as high blood pressure, diabetes, cardiovascular disease, strokes. So cardiovascular disease would be, potentially heart attacks. That can be a health risk. So it's easily diagnosed if you do a sleep lab and find out whether that's leading to stopping or cessation of breathing during your sleep. And how do you treat it? Well, typically you're doing some nose strips. You might do like a CPAP machine, which basically is going over the mouth and nose, or just the mouth or just the nose. But it is assisting in keeping that air going so that you don't stop breathing. But again, how is that going to help your sleep? Well, I frequently tell patients that's not going to help. So if you're already having trouble sleeping and it's leading to health consequences such as high blood pressure or potentially heart problems or maybe strokes in the future, then putting something big and loud on your face is not going to help that. But we do have some laser treatments that could potentially help in addition to some lifestyle changes. So getting active, getting out there, losing weight, eating healthy, that's your part of it. But we actually have some laser treatments that can laser in the back of the throat, and it's called NightLase. And I would definitely check that out, and we will show some clips of that being done. It's not painful, no downtime, and you can have multiple treatments in a series and even continue that on with significant improvement in snoring. We do not do official testing to decide whether it's snoring or sleep apnea, but we can assist with snore reduction, which is present in either one of them. And there are sleep apps or snoring apps that you can load onto your phone, and you can see improvement objectively before treatment and after. So check out our videos, let us know some comments, and definitely give us a call if you need treatment for snoring.